Rights of mental ill patients and nurses' responsibilities. The introduction of the right of mentally ill patients and nurses' responsibilities is every person has a equal right to access the mental health care. So we should not be do the non-judgment. We should not be do the judgmental attitude before them. If you are giving the non-judgmental attitude to the person, they may have to give the more knowledge. Uh, we have to get the more knowledge and how to treat the patient regarding their illness patients. Non-judgmental attitude is very important to the as a healthcare profession to get the more information from them regarding their mental illness, as well as every person has a right to consent. Without patient consent, we should not be treat them because of their wish to access the treatment from the mental health professionals. Some people's we should not be bother about them. We should not be take care about them, about their treatment. They may have to be sometimes angry on us. Sometimes they have to be go the suicide activities. So as a mental health professions, we have to must be to take the consent from the patient regarding the mental illness. Before we have to be giving the any mental treatment to the patient, we have to have to give the information regarding the treatment, what all the planning we have to be set for the patient. Without any planning, without any strategies, and without patient, we cannot be give the mental treatment to the mental illness patient. And some right of nowadays we have to see the right of mental illness patients and nurses' responsibilities. How the rights of the mental illness patients, what are the rights with the mental illness have, and as well as nurses, how their responsibilities to do for the patients. Right to access the mental health care services. Every person has the right to access mental health care and treatment from the government healthcare services. The services should be affordable in cost, of good quality, and geographically access. Um, right to access. Every mental health person has to right to access the to get the mental health care services from the healthcare professionals. um, the Indian government also they should be give the costable affectable treatment to the persons, people who are affecting with the mental health illnesses. Every person has the right to access the mental health care and treatment from the government. Every person means people who are affecting with the mental health illnesses, they have to have right equality to take the treatment from the government. And sometimes we have to be see the biases. If we are going to be give the any treatment to the patient, we should not be do the any partialities regarding their health and regarding among them regarding the treatment. So because of the partiality, because of the uh, unknowledgeability of malpractice of the treatment to the patient, it will may impacting of the physical illnesses also, physically and as well as mental illnesses. Sometimes the nurses what they are doing, the mental health persons, they are not able to take the any treatment from the others because of their mental illness. Because of their disequilibrium, they cannot able to understand what we are going to be teach them, and regarding the treatment how we are treat them. Sometimes they have to be get the fear regarding their health. What they are thinking about that we should be harm them physically and mentally. uh, but actually means we have to have the treatment to them. And mm, some mental health professions what they are doing, if the patients are not if the patients are not support them, they have to be physically harm, and they have to be tie their hands and legs with the chains, which will be impacting of them mentally in more. So the mental illness patients, they cannot able to believe the person who are giving the treatment to them. So before we are going to be give the treatment to the patient, non-judgmental attitude is the very important as a healthcare professions. Because of the non-judgmental attitude, the mental illness patients have given the more information regarding their health illnesses. First we have to begin the believeness from the patient. Believeness is only way to get the more information. Without believeness, no one should not be given the any information regarding the anyone. After taking the information from the patient, we should not be do the non-judgment to the person. Without any non-judgment attitude, we have to have give the treatment to them. Because of the non-judgmental attitude, uh, the person has given the past what they are facing in the past. They have to give the information regarding that. That is the right to access. Every person has a right to access the mental health care services. They should not be do the any partialities regarding the treatment of among the mental illness patients. That is the right to access the mental health care services, right to quality and equality and non-discrimination. All persons with a mental illness must be treated equally and at a par with persons with the physical illnesses in the provision of the medical care, and future cannot be discriminated against on any ground. Right to equality and equality, non-discrimination. All persons with a mental illness must be treated equally. Uh, and some patients are mental illness patients, they have to harm themselves physically. So in that situations, during that situation, the healthcare profession as a nurse, we have to give the more consent to the person. During that time, we have when we are giving to the person, during the when we are giving the person with the consent treatment and behavior, they have to have that kind of behavior is only one way to strengthen the person. People who are affecting with the mental illnesses, they have to be come out from that situations. The behavior is the only way to normalize the person during the mental illness patients also. um, Related to equality, when we are going to be give the any treatment to the persons, we have to have give the equality of the care, where they have to be get them where we have to get the more inequality treatment and accessible quality of the care to the patient. We should not be do the non-discrimination of the patient. We have to be give the medical care, and future cannot be discriminated against on any ground. Right to personal contacts and communication. Right to receive or refuse visitors and communicate with the others. Mental illness patients, it is the third one of the right to have a right to have a mental illness patient. um, Right to receive the or refuse the visitors and communicate with the others. Every mental illness patients, they have to have right to have receive or refuse the visitors. People some are there, visitors are um, give the physical harm to the patient. So the person has to be get the fear regarding their persons. So during that time, we as a healthcare profession, we have to give that we have to have give the right to the person, people who are wants to talk with them, and people who are refuse the visitors. uh, Mental illness patients are also, they want to be talked, the mental illness patients, they not be believe the all the persons in the one way. They have to have refuse the persons in the people. So we have to be recognize the person, mental illness person, why they are um, fear regarding the person, why they are refuse the visitors, why they are not able to communicate with the visitors, why they are have to be doing this kind of behavior. As a healthcare profession, we have to be assess the patient. Regarding that also, that strategy is also is useful to useful for the strategy of the treatment. So every person has a right to receive or refuse the visitors. Not only visitors are refuse the review of themselves from the others, they have to have a strength to or they have to have a refuse to get the treatment from the from the healthcare professionals also. So we have to be give the respect to themselves, respect respect themselves to get the right access from the every healthcare professions, and as well as they have to be refuse the visitors also. Right to protection from the crucial inhuman and degrading treatment. All mental health establishments have to be comply with the basic minimum standards to ensure the people with the mental illness are treated with the dignity. This includes the um, right of way live in a safe and clean environment. Uh, right to protection from the cruel. So every mental health person, they have to save from themselves, so to save themselves from the unknown persons. Because of the unknown persons, the people, the man of people who are affecting with the mental illness patients, they have to have get the fear regarding them, because the person are giving the physically harm the mental illness patients. So they may get the more fear regarding that. They have a right access that to protect themselves from the unknown persons. And as well as every person is to live in the adequate environment. The environment should be clean. The environmental, the behavior of the persons who are around themselves, which will be impacting of themselves, uh, which will be impacting of the themselves to get the normal person of the people. uh, People who are the mental illness patients, as the sanitation of environmental, good clothing and food and water and everything, they are needed for the everything is needed to the mental illness patient as a normal person, how they are living in the world. So the Indian government also to get the act and enacted act together to the mental illness patients to save themselves from the unknown persons, and to save to give them uh, opinion regarding their treatment also. So and that too, the mental health care professions also, they have to have a to right to give the um, environmental and adequate environmental we should be give. We should not be tie the person hands and legs tie with the chains, and we should not be keeping themselves in the room without intelligent and a dark kindness of environmental should be make them the people to get the fearness. So fear, it will be impacting of themselves more. So regarding that situation, the people, they cannot be believe themselves. So that is the mainly cause to refuse the visitors and treatment because of the physical illnesses. During that situation, as a healthcare profession, we have to give the sanitation of the environmental, neat and clean environmental. We should be provide to the mental illness patient, and they have to have a uh, sanitary in a condition where they are living, where the person has to be living. Right to privacy and proper clothing, right to work with the consent and appropriate payment. right to protect you from the physical, verbal, emotional, and sexual abuse, and not forced to shave their head. Some people in the mental in healthcare profession, we have to be seen the most of the patients have to be do the uh, shave their head. So during that situation, we have to take the must be take the consent from the patient. The consent will be helpful to respect themselves, based on their opinion, based on their mental health behavior. We have to be shave themselves after hair. um, every person has to be right to have the privacy and proper clothing. Privacy means if the mental illness patients has given the any information regarding themselves, we should not be review themselves about their privacy, secret to the anyone without any patient contents. We should be keep in the medical records as a privacy. We should not be without any consent. The healthcare professions also should not be review them of privacy privacy of the information. So every person has a right to access, right to get the mental health quality care from the Indian government as a healthcare professions. Every person wants to get the more attachment from the as a healthcare professions because of their behavior, which also one of the important to get the normalize the person. Sometimes the medications also we should not be treat the patient as a normal person. The behavior also will be helpful to normalize the person. Sometimes we have to be seen them. If the person has to do the any good work in the any study at the good at the studies, we have to be follow themselves. Is it right? Was the healthcare profession, when we are giving them uh, non-judgmental attitude and believeness of the behavior towards the mental illness patients, they also do inspire and themselves regarding the anything. When we are doing the good thing before them, they has to be do themselves. They wants to do that. So they have to need a behavior of person from the individual who are being with them. It's not only regarding them of as healthcare profession, and attenders and the family members also, they should not be judge them. They should not be aware the persons, people who are affecting with the mental illness patients. In home also we have to be give the non-judgmental attitude. We should not be harm the physically. The physical harm will be get the person get a fear. So during because of the fear, they may not be believe the anyone. So every person has a right to access mental health. Before any emergency situation says mental health personnel will come to the profession, we should be do the emergency treatment without any consent of the professional of the psychiatry. We should not be do the any treatment to them because of the doses will be impacting of the disequilibrium of the patient.